All right, let's get right into it. Today, we're going to break down one of the biggest and maybe one of the most confusing pieces of health legislation out there, the Affordable Care Act, or as pretty much everyone calls it, the ACA.
I mean, let's be honest. If you've ever tried to figure out what premiums, deductibles, or enrollment periods are, you know it can feel like you're trying to learn a whole new language. And you're not alone. It's a really complex system, and that very complexity is what the ACA was designed to try and fix.
You know, to really understand the ACA's impact, you've got to look at the world before it existed. Back then, an insurance company could just say no if you had a pre-existing condition, like asthma or something. They could also cap how much they'd pay for your care over your entire life. The ACA completely flipped that script. It made coverage a guarantee and got rid of those lifetime caps for good.
So that brings us to the law itself. Its full name is actually the Patient Protection and Affordable Care Act. And it wasn't just a small tweak. It was a major overhaul of the health insurance market with some really clear goals.
These were the four big pillars of the whole thing. The idea was to hit the system's biggest problems from all sides. Make the insurance you get better, make it more affordable, get millions of uninsured people covered, and, at the same time, try to get a handle on the runaway costs of healthcare for everybody. A pretty ambitious plan, right?
Okay, so if the big goal is to get more people insurance, how do you actually do that? Well, the ACA created a brand new way for people to shop for it.
And this is it, the health insurance marketplace. You might also hear it called an exchange. The easiest way to think about it is like one of those travel websites for booking flights, but for health insurance instead. It's one central place where you can see all your options from different companies, compare them side by side, and find a plan that actually fits your life and your budget.
Now here's a key thing to know. You can't just hop on and sign up for a plan whenever you want. There's a set time every year called the open enrollment period. It's usually in the fall, and that's the main window for anyone to get a new plan or make changes to the one they have for the next year.
But of course, that brings up a pretty big question. Life happens, right? It doesn't always stick to a schedule. So what if you lose your job in April or you have a baby in July? Are you just out of luck until the fall?
Nope. And this is where something called a special enrollment period comes into play. If you have a major life event, like losing your job-based coverage, getting married, having a kid, it opens up a special 60-day window for you to get a new plan. So the system has some flexibility built in. You're not stuck if something big and unexpected happens.
Okay, so you're on the marketplace, you're looking at all these different plans. How in the world are you supposed to tell them apart? Well, the ACA actually created a system to make that a little bit easier.
It's known as the metal tier system: bronze, silver, gold, and platinum. Now, this is really important. This has nothing to do with the quality of medical care you get. It's all about how the costs are split between you and your insurance company.
This table really lays out the trade-off perfectly. Take a bronze plan. You'll probably have a lower monthly bill, your premium, but when you actually go to the doctor, you'll pay a bigger chunk of the costs, around 40%. Flip all the way to platinum. You'll pay a much higher premium each month, but the plan covers about 90% of your costs, so you pay way less when you actually need care. It's a balance.
And this chart just drives that point home visually. See how the plan share of the bar gets bigger as you go from bronze to gold? That means your share, the out-of-pocket part, gets smaller. It's a super simple way to see how much financial risk you're taking on. A lot of people end up choosing silver plans because they hit that sweet spot right in the middle, a decent premium for really solid coverage. But listen, it's not just about who pays what. It's also about what you're actually getting for your money. One of the biggest parts of the ACA was saying, hey, if you're going to sell a plan on this marketplace, it has to be real insurance. It has to cover the stuff people actually need.
And these are them, the 10 essential health benefits. No matter what plan you pick, bronze, silver, whatever, it has to cover all of these things. We're talking about everything from ER visits and hospital stays to prescription drugs and mental health care. This was a game changer because it meant no more skimpy plans that didn't cover you when you actually got sick.
So this all leads to probably the biggest question on everyone's mind. How do I afford this? Well, the A in ACA is for affordable, and the law created some key ways to help people with the cost.
The main way it does this is with something called the Advanced Premium Tax Credit, or APTC. That's a mouthful, but the idea is simple. It's basically a subsidy from the government that helps pay for your plan. And it's paid right to your insurance company, so you just see a lower bill every month.
So who gets this help? It's all based on your household income. Generally speaking, if your income is somewhere between 100% and 400% of what's called the federal poverty level, you're very likely to qualify for one of these tax credits. For a lot of people, this is what makes getting coverage possible. So, when we zoom out and look at the whole picture, what are the biggest, most lasting changes the ACA has made to our country's healthcare system? Let's recap a few of the huge ones.
This right here is probably the single most popular and life-changing part of the law. This protection meant that millions of people no longer had to live in fear of being denied insurance just because they had a health condition. It was a massive shift.
And this number 26, this was another huge one, especially for younger people. The ACA allows young adults to stay on their parents' health insurance plan all the way until they turn 26. It's a critical safety net for people just starting out.
And the list goes on. The law made a whole host of preventative care services. Think annual checkups, flu shots, and certain cancer screenings available at no out-of-pocket cost. It also put an end to the practice of gender rating, which means insurance companies can't charge a woman more than a man for the exact same health plan anymore.
So there's no doubt the ACA completely changed the rules of the game for health insurance in America. It created new protections, new standards, and a new way for millions to get covered. But of course, the conversation isn't over. The debates about cost, access, and how to make the system even better are still very much alive. Which really just leaves us with that big question: what's next?